Hello, my name is Anthony. I'm going to be doing the IV insertion and IV bag hang. So I would come in, I'm going to knock, I'm going to introduce myself. I'm going to ask the patient for two patient identifiers. So date of birth and name. They should have a wristband on, so I would just go ahead and check that against the wristband, and then also ask them about any allergies they may have to make sure they're not obviously allergic to the medication that we're giving them or the IV solution that we're going to be hanging. So once that's done, and I know who they are and whether or not they have any allergies, I'm going to use my 11 med admin rights and my general principles and safety practices throughout the rest of the skill. So I'm going to go ahead and perform hand hygiene. And then put a pair of gloves on. And this stuff isn't packaged because I've filmed a few times now, but I'll just clean it as if it wasn't taken out of a sterile package. So this would be unpackaged, and then so would the IV tubing. So I'm going to take this IV tubing and then I'm going to scrub the hub just because it's not unpacked. It's not coming straight out of the package. And then this side as well. I'm going to take this end and without touching anything else on the IV bag, push it in and turn it. Okay. And with the clamp on, I'm going to go ahead and hang it. And make sure I check for the expiration date in the bag. Okay. I'm going to squeeze this, get this about halfway full. Okay, and then I'm going to prime the rest of the tubing while I'm clamping, and then just letting it fill the tube. Okay, and then once that's completed, I'm going to assess the entire line for any air bubbles. Okay, and making sure there's no air bubbles at all throughout the entire line. And this would be capped. I lost the cap to this, but it would be capped. And I'm just going to throw it over here for later on. So that's there. I'm going to go ahead and remove my gloves, throw them away, and then perform hand hygiene. And I'm just going to set my supplies up so that once I'm ready to go, everything's ready as well. So I have this Tegaderm. I'm going to put this on the pad here. I got my cleaner, my J-loop. I have a saline syringe, my IV catheter, my tourniquet, some tape, and then an antimicrobial wipe. So I'm going to take my J-loop and then just wipe the both sides vigorously, and then I'm going to let it dry, and then I'm going to attach it to the syringe, so it's ready to go whenever I remove the needle from the catheter. Okay, and then I'm just going to prime this as well. Okay. And we're gonna So I'm gonna start on the bottom of the hand, and then just work my way up, trying to find a good vein to inject into. So about halfway up, I'm gonna use this one, and mental note this spot, and the tourniquet's gonna go about 2 inches above that spot. So I'm going to just put the tourniquet underneath. Okay. And got this vein right here. Okay. So we have this syringe ready to go. And so this is the spot I'm going to use. I'm going to go ahead and tie this. Put my gloves on real quick. I'm going to untie this. Put my gloves on and tie it. Okay. Now I already did hand hygiene, so get this tied up. Okay. So just go right here, and I'm going to clean it. Okay, I'm going to put this off to the side. I'm going to let it dry. Then I'm going to get my needle and cap it. Throw that over here with the bevel facing up. I'm going to take it at a 15 to 20 degree angle and insert it until I hear a pop and see a flash. Okay, once it's there, I'm going to undo the tourniquet. Place my finger above the site to occlude the vein. Push the catheter forward and remove the needle, engage the safety, discard it, and then I'm going to stabilize the catheter while I attach the J-loop to it. Okay, I'm going to aspirate to make sure I'm in the vein. We're good, and then I'm going to go ahead and flush. Okay, once that's done, I'm going to remove the saline syringe, toss it to the side, and then I'm going to stabilize the catheter site and put the Tegaderm dressing over it. Making sure that you're not covering the J-loop, just the catheter portion of it. Okay. All right. Just put some gauze underneath it, just in case there's anything coming out of there. All right. So from here, we're going to annotate the side of the patch with the name, initials, and the gauge size, and then I'm going to remove this extra layer. Okay, toss it to the side and assess the site for any like swelling, bleeding, anything that could indicate infection, anything like that, just to make sure it's looking good. There's no problems. Where's my tape? I'm going to get some tape. Imagine I got some tape, and then I'm going to put it over. You don't want to put it anywhere that blocks you from seeing what's going on at the incision or the injection site, but you can put it around to sort of stabilize the tubing and make everything else more secure. So you're going to put some tape on there while you assess the site, and then you're good to go with that. You're going to take your gloves off, do hand hygiene once more. This is going to go in the sharps container. And then from here, you're going to take one more of these antimicrobial wipes and scrub the hub of the J-loop. Pretty good. And you're going to do the same. I'm going to do the same for the IV line, just because there's no cap on it. So take this over here. Make sure it's good to go. Okay. I'm going to connect the two. Alright, and from here, it's a gravity hang, so you're going to control the drip rate with this clamp, and as you release the clamp, you should see an increased drip rate. And so per whatever order you have, you're going to go ahead and increase the drip rate until you have the correct one. You can use your watch to sort of time how many drips come out every 30 seconds, to just manage that way. Once you have the correct drip rate, you can let it be. You're going to clean up your mess that you've made, and you're going to maybe assess the site again just to make sure after you've inserted the line nothing's going on. So any redness, swelling, anything like that, any signs of infection, anything like that, and you clean up the site, you're going to document, report, record, and should be good to go.